tell me it's okay.
Yeah, so because we'll upload this onto our YouTube page as well. So if anybody wants to want to re-review this or go over some points that she give you, so be it. So let's get into it. So first and foremost, I want to thank everybody for coming and attending. I'll be keeping an eye out on the waiting room to make sure that we get everybody in that has RSVP'd. So it gives me honor and privilege to introduce everybody to our great keynote speaker. Our distinguished speaker is Dr. Michelle Giddings-White. She is a double board certified nurse practitioner with extensive experience and expertise in managing both medical and mental health disorders. She is also the proud owner of Peaceful Mind Psychiatric Services, a leading outpatient psychiatric clinic right here in Las Vegas. She is highly regarded as a clinician, a speaker, and an educator, well respected for her work and diverse clients across many settings. Her contributions to the nursing profession as well as the mental health field has been widely recognized. Dr. Giddings was honored with the 2022 Nevada State Award of Excellence in Practice from the American Association of Nurse Practitioners, and in 2020, the National Award for Excellence in Practice from the American Psychiatric Nurses Association. In addition, on June 19th, 2019, she received a proclamation from the mayor of Las Vegas for her outstanding efforts in providing behavioral and mental health support to our community. Dr. Giddings-White's mission is to improve access to quality mental health care, reduce the stigma that surrounds mental health. What makes tonight especially meaningful is that she is also a former member of SNBNA. So this is, like I said, a true homecoming for us. So please join me in giving a warm SNBNA's welcome to Dr. Michelle Giddings-White.
Thank you. What an introduction. I'm listening and thinking, wow, that's impressive.
So is that me?
Okay, well, thank you for that. But tonight is not so much about me, but about spreading the word about mental health and, getting all the members and all the viewers who are here tonight to leave with a little more knowledge about how to protect our mental health. So I'll lead by saying again, first off, thank you everyone for joining. I know it's late at night, and the fact that you're here, the fact that you're showing up as nurses, and I think we're mostly nurses on this call, is that we know how rare our time, how precious our time is. And the fact that you're here to talk about something as important as mental health shows me that you want to do better with your mental health. So the title of tonight's presentation is, Are you caring for your mental health? Are you caring for yourself? So we're going to look at protecting mental health, protecting our mental health, and preventing burnout. Because as nurses, again, we're in one of the most rewarding professions, but we're also in one of the most demanding professions. And I'm not talking about physically demanding, learning to turn people, proper body posture. I'm talking about emotional demands also. And that in time takes a toll on us. So hopefully, by the end of tonight, we go to the next slide. And I just want to go over some of the objectives that we have. And I know it's on the screen. I'm going to read off some of the objectives because I want you to really pay attention to, let me say, okay, it's telling me it's being recorded. Okay, good. Some of our learning objectives for tonight, and you could read, but I'm going to read it out to you because I want you to understand how important it is that we learn to identify early signs of burnout, including, like I said, the physical and emotional and behavioral signs of burnout. We want to explore some of the prevention strategies and techniques and routines that we could use to enhance our well-being, because there's things that we could do. Then we want to promote some sustainable habits, because we're teachers. We're always telling our patients and the people in our circles what they should be doing to protect their mental health and build resilience. So we want to learn more so we could teach more and tell more. And then I want for us to just encourage some open communication to reduce the stigma surrounding mental health and burnout, because that's a big thing. We need to start looking at talking openly, having conversations about not just ourselves, but about mental health in general. Because the truth is, if we don't care for ourselves, we can't fully care for others. It's a fact, right? So on the next slide, I am just gonna challenge you to do a self-check. Do a self-check. And I want to ask you, are you taking steps to protect your mental health? Are you ignoring signs that your body's sending you, some signals that you need to do better? Right? Because look at the following slide that's coming up. This is a reality check for us, all of us. 60% of nurses, more than 60% of nurses report burnout symptoms. 1 in 4 of the nurses that you know consider leaving the profession altogether. It's too much. The emotional toll, the physical toll on your body, and the behavioral changes that we feel from all the stress. I mean, people are leaving the profession. The numbers are sobering, right? But we don't need numbers to tell us, because we live it, we feel it. The rates of depression, anxiety, even suicidal thoughts are higher for nurses than in the general population. So for any nurse looking at this, this is serious. It's serious business. Like I said, we're in the most rewarding profession. We're in the most trusting profession. But if we're not taking care of our mental health, we become vulnerable to some of these mental health issues that could affect nurses. So, and why do we have these challenges? Look at what we face daily. On the next slide, we're going to talk about the things that we face daily. And we don't need all the statistics to tell us that, because like I said, we live it, right? Those long shifts that go on and on. Some of us do 12-hour shifts that turn into 14-hour shifts, and then we're still working. We're juggling sometimes too many patients. I've been a nurse for quite some time now, and I could tell you from the beginning of my profession, we've been talking about nurse-patient ratio. Is it sufficient? It's too much. And today, as I'm becoming one of the senior nurses, we're still debating what is too much for a nurse to not feel these emotional tolls and burnout that happens in nursing. And again, when we think we're done at the end of our day, what do we have to go face? The charting, the documentation, and everything that comes with that. Because as nurses, we already know if it wasn't documented, it wasn't done, right? That's what we're told from the beginning of this profession. So the work seems to be going on. And the hardest part is we take this home with us. If anyone on this call who's going to be listening to this tells me you're a nurse and when you're done, you put the pen down and you get in your car and everything's gone, I would challenge you on that, because we carry it home. When we walk through the door, our mind is sometimes still on that patient that we left from our shift before, right? And you guys could join me on this, because I know I've had this happen to me several times in my profession. Just think to yourself, have you ever found yourself at the end of the night, after you had a long day and a challenging patient, and you go to bed and you wake up in the middle of the night, sometimes 2 a.m. in the morning, and you're replaying what you did, what you could have done differently, and that's affecting your sleep? And we're going to talk about sleep and the importance of sleep. So instead of sleeping, we're still up thinking about the day before. Think about it, because I'm sure I'm not alone. in that, or maybe I have so much empathy that I'm not sleeping thinking about people. But it's one of the challenges we have as we continue to work in this caring profession, right? I think about some of the times when my body shows me signs of burnout. And I'm not here to talk all the time. So I'm gonna talk for the first 30 minutes. I shared this with Angel, and I want us to have a discussion because that's one of our objectives. But for me, I know sometimes when I have a really tough day and challenging cases that I work with, I find myself many times pulling into my driveway, sitting in the car. If the music is on, I'm listening to the music, but I'm not really processing anything or doing anything with that music. Or sometimes it would just be silence. And it takes me a while before I could pull myself out of the car and walk into the house to face the family. So we need to decompress sometimes from our day. And that's, again, our body's telling us we need some time to slow down. So I want us to learn to not ignore those signs that and signals that we get from our body trying to tell us maybe you're doing a little bit too much, right? So on the next slide, we're gonna really talk about what is burnout. Thanks, Angel. I was just looking for myself. What is burnout? The American Psychological Association defines burnout for us, right? And you see that I put that little picture of the nurse because sometimes that's all of us at a different time or point in our career. I just can't do this anymore. It's too much. That feeling of overwhelm comes with our profession, but we have ways that we could process that. So the APA says burnout is the mental, emotional, or physical exhaustion that's usually accompanied by lowered performance, decreased motivation. Have you ever felt that? And a negative attitude towards oneself and others, right? So you could tell when you're experiencing some early signs of burnout. Because remember when we became nurses, you telling everyone, hey, I'm a nurse now. I'm going to do this. I'm going to save the world, And then we get to this point in our profession where we're like, this is too much. That patient in room, so she needs to stop ringing that bell. You don't want your patients to call you anymore. So some of the key features is that exhaustion. We're so tired. We're like this lady in the corner, just sitting in the middle of the shift. I can't do this anymore. And that's when people contemplate leaving the profession instead of paying attention to their mental health and seeing how can we change course, right? The cynicism and detachment. Now you're not talking to this person at work, you're not talking to that person. Now you're in that, you're so cynical, you're like, I'm just gonna go do my 12-hour shift and get out of there. Nobody better talk to me. I'm not doing the potluck today because I don't need to be bothered with anyone. We start finding all these reasons why we just don't want to engage anymore. So we're detaching. That's a sign of burnout. And then it starts showing up in your work. Reduced professional efficacy. You're not participating in meetings because you just don't want to be there. You don't care about the changes that needs to be made. So you start detaching from work itself, and then your professionalism starts being compromised because of all of it. So in short, burnout, again, another explanation of burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, right? And I pulled something in here because we have burnout that leaves you feeling so drained that you don't even have the energy to care. That's when I talked about that cynicism. And then there's the compassion fatigue that's almost unique to our profession and as healthcare providers. Compassion fatigue comes from that caring until you feel like you can't care anymore. Is when your heart just feels like it's on low. And suddenly you can't be nice anymore. Even being nice feels like it takes so much effort to be nice. So it's that feeling, when you feel like you have a patient and you really like this patient really like you, and you walk in the room and the patient's like, darling, how are you doing today? And that darling just feels so irritating to you because you don't want anybody calling you darling. You just want to get it over and go home. So that's compassion fatigue, when you don't even want to care. So as we go through, I want you to recognize, did you ever feel this? Do you feel this? There's signs telling you that there's things you could do, and we'll go through some of those signs as we go further. I'm looking at the slides as we go on too, so we could switch to the next one. Burnout, is it serious? Is it a mental health condition? It's really not considered an Axis 1 that, it's not in the really DSM and all that stuff, but there's a lot of features that mimics mental health conditions, specifically depression and anxiety. So what differs? What's the difference is that burnout is usually work related. And someone asked me, well, can a housewife get burnout? I'm like, isn't a housewife a tough job? So yes, people could get burnt out from work, general work, any work. So it's work related. And usually when that stress of work is removed, somebody burnt out at one job could leave that job and go to another job and become the happiest. Oh, child, that job was stressing me out. And their whole personality changes because they're in a different environment. Depression, though, is more permanent. Depression sticks around even if you change your environment, even if it's prolonged, and a lot of times does not resolve with those sorts of intervention like changing environmental stresses. So burnout, although it's not on the DSM as a diagnosis on its own, burnout could lead, untreated burnout, unrecognized burnout could lead to serious symptoms like depression and anxiety. So that's why we're talking about mental health, and burnout is a precursor for some people to depression and anxiety. All right, so next slide. What are the signs of burnout? Earlier on, we talked about physical symptoms. We talked about the emotional symptoms. So the signs that you're getting burnt out is you start feeling that fatigue, that tiredness. I don't have the energy to do this. You, again, disengaging, that headache, body aches. Where does that come from? As nurses, we know a headache could be a sign of inattention, right? That's why we call them tension headaches. Then we get the back pains. Like, girl, I don't know, my back just hurts so bad. I think I need a massage. But do we get the massage? No. We talked about it, but we don't have massages. We should be taking regular massages because those back pains, attention, it's a sign that your body's tensing up, and it leads to other issues if we don't take care of it. Then trouble sleeping. Well, I don't even know if I should put sleeping here because nurses, do we sleep? Really? Are we taking care of ourselves when it comes to sleep? Because I have a whole segment for you guys on sleep. So trouble sleeping leads to significant problems. Irritability, the behavioral signs now, when, nurses don't even want to come close to you because you're so irritable. They're not asking you to help with anything. I'm gonna do it myself because she's on one today, right? That irritability, frustration, mood swings, those are changes in your mental health now that's happening because of the burnout, withdrawal from your coworkers, like I just said, and that procrastination, lack of engagement coming from that low motivation. So again, all signs we want to be paying attention to when we deal with, when we work in the profession that we're in. I'm going to keep myself good on time because I want to save time, like I said. So we started at 8:30, so about 9. Still have some time. Could we go to the next slide? So we think about some things we could do though, because we're talking about problems, And one thing I learned a long time ago is once you talk about problems, you need to come up with some solutions, right? What can we do to mitigate some of these signs and symptoms of burnout in our profession, the mental health challenges that it brings forward for us? One of the key things we could do, and I want to spend some time on sleep, is prioritize sleep because sleep is a medicine that we take too lightly. The restorative effects of sleep is a lot of times overlooked in its importance in brain function and emotional function. So what do we know about sleep? It affects neurotransmitters in our brain when we don't sleep. There's things like the amygdala, and you hear those names and we're nurses like that. That's a little deep, but I want you guys to learn a little bit about these little parts of the brain that sleep's affected. The amygdala, the mood center, where those emotions and anxiety and fear and all those emotions are regulated. The prefrontal cortex, the hormone systems that are regulated with sleep, they're restored during the sleep cycle. What we know is as adults, we need 7 to 8 hours of sleep. And if I were live with you, I'd say, put your hands up. Let me see who's getting 8 hours of sleep every night to see who's not being as truthful as they should be. Because sleep is such a rare thing when you're working really hard. But less than 7 hours of sleep leads to sleep deprivation. The effects of sleep deprivation on mood symptoms in mental health, I work in a clinic. I see people over and over with depression, anxiety. And one of the first questions I ask is about sleep. How much sleep are you getting? How are you sleeping? Because the changes in people's mood and stuff is well documented. It's linked to sleep deprivation. And the problems we see as a result of that is anxiety, depression, mood swings, right? What happens when we sleep? Because I introduced the amygdala to you guys. That little almond-shaped part in your brain, if you wanted to go look at a brain, a picture of a brain, heightened activation occurs in that amygdala when we sleep. It's responsible for, when it's heightened, when we don't sleep, it becomes overreactive. And that's responsible for a lot of the emotional dysregulation that we feel and increasing anxiety from lack of sleep. So when we sleep, again, restorative, it gets to restore, do what it's supposed to do, because we're not going to go into a whole biology class where I'm going to go into neurobiology with you, but I'm telling you, you need sleep for that system to be to restore itself. Prefrontal cortex. I'm giving you guys some a little biology of the brain. What happens in the prefrontal cortex? What is it responsible for? Executive functioning, thinking, emotions, personality, judgment, self-control. I mean, all those impulsivity, impulse control, right? So the prefrontal cortex also restored with sleep. So think of what I'm saying and think about, well, if that's responsible for all of that and it's restored during sleep, what happens when I don't sleep? We know because when we don't sleep, everything that I just said is kind of malfunctioning, executive functioning. Oh, I forgot. I couldn't think through that. I don't know how I forgot that. I know how you haven't slept well for the past 4 nights. Emotions. What happens when people don't sleep? Road rage, irritability, they're on edge. That's because that system wasn't restored. And I'll let you know that the amygdala and prefrontal cortex exchange information. So they kind of talk to each other. But as females, again, we deal with hormonal dysregulation throughout our lives. Thank you. But the hormone regulation also restorative during sleep. One of the hormones that we know to be associated with stress is affected with lack of sleep, and that is cortisol, right? We have studies that show that sleep deprivation can cause the body to release more cortisol during the day. When we have more cortisol, stress levels go up, right? So we want to make sure that we get good sleep. I don't want to tell you get good sleep without telling you how to do that and understanding the sleep cycle. Because when we go to bed, and we should use our bed for sleep and other bed activities, but not for things that are not related to our sleep, like reading, scrolling through social media over and over, watching the same post, watching the outfit that somebody wore to the last party, and all these things, because that keeps us awake. That light is keeping us awake. So set a good sleep routine that your body could get used to. And I'm not being hypocritical. I try over and over as a nurse, as a busy nurse, to get into a good sleep routine. It's difficult, but it's doable. So set a good sleep routine. Try to practice going to bed around the same time every night. It's almost 9 o'clock and I have you guys here, so I want you to stay with me. You're going to go to bed late tonight. But set a sleep routine that's going to be something that you could work into your schedule. Same time to bed, same time awake, and your body gets into that sleep cycle. The stages of sleep, we have 4 stages. We want to get to stage 4. And I will tell you, people with insomnia have difficulty getting to that stage 4, which is why they're so miserable. That restorative sleep doesn't come for a lot of people. Stage 1, yeah, we do that. Like when you guys right now having to sit and listen to me and it's kind of late at night, you're probably going into stage 1 right now. Muscle relaxed, the heartbeat slowing down, the brain waves are slowing, and if you had a little pen in your hand, it's probably slipping out right now to fall. Stage 2 is when that heartbeat really goes down, your body's temperature starts going down too, and that pen is actually dropping out of your hand now because your muscle going into almost full relaxation stage. Stage 3, this is a deep sleep, right? The body functions at its lowest right now, but it's still non-REM sleep. This is where a lot of people get a lot of their sleep and then they wake back up before they get to that REM sleep. But this is believed to be one of the most critical stages for regenerating the body and brain too throughout the night. So stage 3, although non-REM, is still good sleep. Stage 4, you have to get into deep sleep. If you're not getting into that deep sleep, this is where the cognitive function, like memory, dreaming, occurs in this stage, the REM cycle, right? And as a result, we have increased brain activity and muscles that you would normally control, you can't, right? It's sort of a paralytic, you're sort of paralyzed during that stage of sleep. The muscles are really relaxed, the body's relaxed, and things are being restored. So I want you to look at sleep now as strong medicine for mental health. If you give the sleep the importance, a lot of issues that you feel will seem to get better. So I wanted to spend that time on that slide because I can't emphasize when I do sleep lectures or anything like that, the importance of sleep. Okay, and we went a little deeper into some of the brain function. So now we could go to some other things we could do. And we're gonna go through these slides a little faster. Next slide, if my host didn't, yeah, if I didn't lose my host. Okay, what other things can we do? Well, nutrition, it's a given, and exercise, right? 30 minutes of walking a day goes a long way. I like to say that when I talk about exercise. 30 minutes of walking a day goes a really long way. So we all have 30 minutes, whether it's on a lunch break, we get an hour lunch, we could have a lunch and then take a walk with a friend or something around the building and get that movement in. Nutrition, we know there's a lot of resources for healthy nutrition. Look at some resources and start using them. Learn to set boundaries. This could be a lecture by itself. Saying no without guilt. You should be able to say no. No is a full sentence. No, I can't do that right now. I'm not feeling well. No, I can't take that extra patient on right now. I think we need to call in another staff. No is a full sentence. Be able to advocate for yourself with that sentence. Take your mental health days. You have sick days. There's no awards for not using sick days. And they could be restorative in itself if you feel overwhelmed. So if the boss says, why did you take a sick day? And, we saw you at the park, say, yeah, that was my mental health day. I was restoring myself, right? And quick recharge. Breathing exercises. Learn to breathe in ways that restore your body, that relaxes your body. So the next slide we're going to go on to, and to wake you guys up, we're going to do a little breathing exercise. So if you're in a place where you could actually close your eyes, you can keep your eyes open. I find it's more relaxing to close your eyes. And we'll do some box breathing techniques. And box breathing is just like it says on the slide. So you could read it and practice it, or I could just tell you what to do. You inhale for 4, you hold for 4, you exhale for 4, and you hold for 4. And if you do that a couple times throughout your day, what it does, it signals that your central nervous system to slow things down. Okay? It slows your breathing, it slows your heart rate, and it's in itself one of the cheapest ways and easiest ways to reduce anxiety. So do one box breath with me, and then you can practice it later. Inhale for 4. Exhale. Hold for 4. And I did that wrong. I didn't hold for the 4. So now I'm going to make you breathe again the right way. Inhale for 4. Hold for 4. Exhale for 4. And hold for 4. So you see how you want to breathe again faster, because hyperventilating is when your central nervous system is speeding up a little bit, and that increases anxiety. Slowing it down decreases anxiety. So that's just a little technique you could practice, box breathing, when you feel anxious, and you get really good at it, and it's going to help you to slow things down, slow that CNS system down a little bit. All right, so we could go to the next slide, and that next slide is building resilience. How do we build resilience? Well, what is resilience? Being able to bounce back, right, from anything. Resilience, we just throwing it, we sometimes we just throw that word around. Well, I'm resilient, she's resilient, but are you really resilient? It's coming back from burnout. It's doing the things we just discussed so you could regain your mental health that you kind of lost along the way, and decrease that feeling of burnout. And one of the big things about doing that is not doing it alone. It's really connecting with people, not only inside of your job, but outside work. It's good to connect with friends in nursing, because sometimes you want to tell a nursing story that only a nurse would understand. If you tell a nursing story to someone who's not a nurse, they're going to think you're insensitive, because in some ways we get a little desensitized. But talking to your colleagues about how you feel about a certain situation at work and really processing it instead of just venting and being cynical about it helps. Connections outside of work, vital, right? Because all your friends can't be in your workplace. So I dare you guys to call a friend that you haven't spoken to in a long time and say hi, and ask them, not are you taking care of your mental health, but how are you really doing? Because we lose connections throughout life, and some of those connections were vital and we didn't pay attention to them, so they died. So sometimes we need to look back and pull another friend back into a circle that we kind of lost along the way. Then purpose. Remember why. Remember why you started this journey, whether it's in nursing or whether you're not in nursing, but you happen to be listening to this video at some point. What got you started? What was your purpose? What did you want to accomplish when you started out, right? And for nurses, I'm sure it wasn't about, I want to accomplish getting all my notes done before I'm done, right? We had more mission than that. So I want you to remember, get back in touch with that passion and use that to continue to find purpose in what you do. And yes, gratitude. Gratitude is the next one I have. And gratitude always sounds kind of like, ugh, it's kind of cheesy, it's kind of cliche. But having gratitude, taking accounts of what are some of the good things that happened throughout the day, who was really kind to me, and can I return some of that kindness to them, and being grateful. I mean, like I said, we're in one of the most rewarding, trusting professions, and we worked our tails off to become nurses. And we're grateful to be in this profession. So having gratitude that we were able to overcome what it took to be where we are right now, and remind ourselves why we do this, reminding ourselves why we got into this work and why we're doing this work, would help you to build resilience and growth. I would say resilience is growing, right? Learn some new skills. I think I took that too seriously, and I just kept learning and learning and learning, and that's why Angel had to read this whole long list of things that I've accomplished. And I'll tell you guys before I end this, because we're going to go to the closing slides pretty soon, one of my biggest accomplishments is not there, and it's being a mom. So I'm going to start adding that to my long list of achievements. So yes, keep growing, keep learning new skills, and you're in a profession that we have continuing education. So without doing that constant learning, we begin to feel stuck, and that's not a place that you want to be. So as we go further, I just want to tell you, if you're working in an environment that makes you feel burnt out, you have to advocate for yourself. So we'll go to the next slide and talk about what can we do? What are some workplace strategies? Because if it's happening in the workplace, here's the truth. You could do as much of these skills and, use all these different strategies I told you, and boundary set as much as you want to boundary set. But if you're in a system that's not kind to nurses and it's not meeting your needs, the burnout is going to continue. So we have to advocate for ourselves, right? One of the things in nursing is staffing, and I said it before and I'll say it again. You have to advocate for fair staffing rules. Even on your own unit, ask for another nurse to work alongside you. If you're working in advanced practice like myself and you have too many patients, hand over some patients if you know you're having too much. And I know in our practice, we're a nurse practitioner practice, and we hand over patients a lot to each other when we feel like it's too much or overwhelmed. So, and patients appreciate that, because if we can't see them, we have somebody else that could cover. So mental health days without guilt, like I said, take those days. If the administration have days for you and you feel like you're feeling burnout, talk to your supervisor. Say, I'm calling in sick. It's acceptable. And it should be acceptable. If you could call in sick for a headache or for the flu, you could call in for a mental health day because you're feeling anxious, you're feeling overwhelmed, and you need to regroup. Access to counseling. If you guys feel like I talked about some things here and it felt like, well, I've felt that for so long and I haven't done anything about it. Access to your counseling services, if your job offers it. Anybody could go in and do a psychiatric evaluation just to see where you are. How do you feel? Call a counselor, a therapist, and say, I just want to talk about myself because I have these feelings and I'm not sure where it lands on that dartboard. Am I hitting the bullseye for a diagnosis, or am I far off and just need to integrate some mental health strategies into my life? Okay. And if you're a leader, before we're done, I have to let you know, if you're a leader working in this profession and you have nurses working under you or anyone working with you, because it's not just nurses, anyone working alongside you, check in on them, be kind to them, allow them to take their lunches, allow them to take their breaks, allow them to have time away from work where they could recoup too. So you just don't manage like people and staff. You help to protect their mental health also and help them to thrive in whatever work setting they're in. So again, I made it 9 o'clock. We took 39 minutes so far. So the takeaway to this, and we could go to the takeaway slide and we're going to go through it quickly. Strength in nursing is not about doing it alone. We are a together profession. And anyone else, like I said, looking at this, if you're in healthcare, this is a profession where we need to bind together. We're in an atmosphere where healthcare, I feel healthcare is always under attack. I don't know if it's just mental health under attack or healthcare, but it's a community and it's about community. So reach out if you're listening to this wherever you are. Reach out to one of your colleagues and find out how are you doing, and tell them about sleep and how important it is. And I want you guys to really care for yourself really fiercely. As fiercely as you take care of your patients, I want you to do that for you, because it's about pushing for system change, but also for ourselves and our colleagues. All right. So as we go to the next slide, we're done. We're going to go to Q&A, but I want you to know, and I want you to hear this, because I put it on this slide with Q&A, because I really want you guys to listen clearly to what I have to say to you now. You matter. You matter. Your mental health matters. And the world needs you, but they need you to be well. The world, your patients, your family, your friends, they need you to be well mentally. Okay, so that is my closing statement. And before we go into question and answers, I went to a conference this week, and there were some phenomenal speakers at the conference. And there's a research study that was done by Dr. Susan Jane. She's a psychiatrist and a researcher. And it showed how people took initiative for themselves and improved their mental health through a program that they have. And I want you guys to take this website down. I'm not being paid for this. I'm just promoting mental health wellness. So it's called the WILD, WILD, number 5, wellness.com. WILD, number 5, wellness.com. And just log on and see if this is something you could implement in your life. It's a 30-day journey to wellness. Thank you for listening to my TED Talk.
All right. Hey, we're going to open it up for any questions or anything that Dr. Giddings can answer for you. As most of you guys do know that we're on the call, except for maybe the guests, my nurse practitioner project was actually on burnout. So this is definitely something that I really appreciate. So it looks like we got Miss Tracy that raised her hand. So go ahead, Miss Tracy.
Well, thank you so much for this valuable information.
Your dog is louder than you are, Miss Tracy.
Yes, yes.
Dog got a question.
Thank you for all of this knowledge and all of this that we need to take to heart. I think my question is right at the beginning, you said to take a self-check. What are we checking for, and what does that look like?
So what she was asking is about the self-check, and what does that look like?
Yeah. How are you feeling? Do you feel like you're taking the best care of yourself, of your mental health? Are you practicing good mental health strategies? It's like hygiene, right? Are you using affirmations? Are you planning to have a good day? Are you handling stress well? Are you overreactive? There's so many things we could do in a self-check. Are you holding yourself accountable? Are you receiving feedback and not taking it as criticism? All those things.
Thank you.
Anyone else? Looks like we got some questions, and looks like Dr. Giddings did definitely share the website. Someone also said, is there a way to get on a sleep schedule when they work night shift?
Yes, there's so much studies on night shift work and that dysregulated sleep cycle. There was is it the World Health Organization? I don't want to misquote. There's one study that said, and if you guys need the information on this, because this is going to go live and the world's going to see it, I don't want to spread misinformation. But nurses who work the night shift were equated by one study to be as at risk as people that are exposed to a carcinogen because of the toxicity of not getting that sleep and what it does to the brain and the body. So for night shift workers, you really need to make sure your circadian rhythm is different, is off. That hypothalamus that works on sunlight and stuff is a little bit different. It's off. But getting that sleep, getting that sleep during the daytime, having blackout curtains, and setting a time when you get home from work because you were awake to put your body to rest after you work, it's very important and vital, because I know I worked night shift as a young nurse, and when I look back at sleep deprivation, I'm like, wow, can't believe I did that to myself. Because I would work the night shift, come home and take care of young kids, and maybe get a couple hours of sleep before it's time to go back to work. And that's the danger of the night shift. If we're not getting ourselves in a sleep cycle where we're getting that 6 to 8, and I say 6 to 8 because we run on 6 to 8, but all the research says 7 to 8. So you need that sleep. So that would be my advice in terms of sleep cycle, working the night shift. Make sure you have a nice, comfortable, cool, dark room where you could get sleep.
Let's see. She said, thank you.
You're
Uh,
welcome.
Anyone else with any questions for Dr. Giddings? Perfect time to ask. Like I said, my project definitely covered this as well, but mine's also happened during the election. So I was dealing with external stressors from school to dealing with the election to getting my project done. So,
Yeah,
uh,
and I'll, since no question, one of the questions that come up, because I, talk about depression and burnout and stuff, is that how do I know that it's burnout and not depression? And like I said it earlier, but there's some key signs that tell people that this is depression. I have a question, but I'm having issues. I can't read the rest of that. But I'll say that after, because I started this conversation, but someone has a question.
yes, Terry, I see you got your hand up, and then I'll go to the one that's in the chat.
Okay, could your cortisone level affect your burnout and your sleep pattern?
Absolutely. Cortisol is known as de-stress hormone. It affects everything in our body, because when our stress goes up, it sends signal that we need to be in fight or flight, right? So of course it affects your sleep. If your cortisol level is that high, then you pretty much can't really relax to sleep. So cortisol is called de-stress hormone for a reason. It dysregulates mood, anxiety, sleep. I mean, it's that bidirectional almost kind of thing. If you have high cortisol, you can't sleep. If you can't sleep, your cortisol level increases. So the key is try to use measures to get that sleep, because that's the one we could actually easily control.
And it looks like Miss Nickelberry has a question. You can come off mute.
Okay, thank you. Thank you so much, Dr. Giddings, for your presentation. It was absolutely very informative. But you mentioned being a mom. I'm currently a nursing student. I work a full-time job, and I'm a single mom. So my question to you is, how can I go about setting healthy boundaries and, you know, implementing these strategies without feeling guilty?
Okay. Well, first, from one former single mom to another, you're going to get through this with flying colors. And secondly, build community when you have multiple different things going on. You're working, you're in school, you have a kid, build community, build a sisterhood around you. That's going to help to support you. That's one way. The second thing, in setting boundaries, like I said, you have to evaluate yourself. That's why I say, are you taking care of yourself? You have to evaluate where you're overextending. And when you're overextending, when you feel you shouldn't be doing this, but I'm doing this because if I don't, they're gonna feel guilty. I have that problem myself, so I can't sit here and say I don't. And I'll tell you a true story. I had a party that I was invited to and I really wanted to go. It would have been beautiful. But I was here thinking, I have this other thing to do the next day, and it's family related, and I'm having all this guilt now because I already said I was coming, and now I have to change my mind. And I had to take some of my own medicine and said, what are you doing? Just say no. Just say you
Yeah.
can't come. And but it didn't take me doing it. It take one of my staff coming in and me talking to her and telling her, I haven't even figured out what I want to wear, and I have this other thing. And she said, just say you're not going.
Yeah.
So it takes community, right? And I felt so relieved when I said, unfortunately, I won't be able to make it because there was a lot of my colleagues going to be there. Set boundaries, build community, have friends that you could talk to and tell them how you feel and let them help you with that no. Because,
Okay.
yeah, when you feel it on your own on the inside, we have an old saying in Trinidad that, because I'm from Trinidad originally,
Okay.
we have a saying that we say, I'll say it in my accent, who in the kitchen feel the heat, right? You're in the kitchen, you're feeling all that stress. Somebody out on the outside could see the smoke and know there's something going on, and they need to come in and tell you, hey, it looks like it's really hot in there. I think you need to step out here a little bit. You're not seeing that you need to step out because you're dealing with it. You've gotten used to that. It's like, you're not even realizing that you need to pull yourself away. Community is going to tell you, hey, Guana, how do you say it? Guana.
Grayana. Grayana.
Hey, Ariana, you need to come out with us this evening. We're just gonna go take a walk around the park and something. I think you need to come. Because when you build community, they see you. When you build a real sisterhood, they see you. They see your struggles. So I would advise build community for one. And secondly, you look at your boundaries, where you're overextended, and then say no. Learn to say no. When you get used to saying it though, sometimes people get so good at it, they're like, nope, no, nah, mm-mm. Right? But practice it in the mirror. No,
Thank you so much.
you're welcome.
And we still have time for a couple of more questions. Anyone else have any questions?
Yeah.
Let's
I
see.
was
Make
starting
sure
to share. Oh, there's this one.
there's one. Yes, Miss Alexandra, please come off of mute.
Hi. So first of all, the presentation was great. I'm glad I got to attend tonight. But I've been a nurse for 10 years, and in December I'll be graduating as a PMHNP. And I think I'm kind of like anticipating that new grad feeling, and that's I'm getting stressed out. Like, when you started as a new nurse, you were brand new. And I keep reminding myself that this is the most prepared I've ever been for any job, right? But I'm like having, I don't know if it would be imposter syndrome, but it's making me very anxious about the transition into a new role because I feel like I'll be starting at the bottom again. Like, I don't know. Do you have any advice for that?
Yes, I'm going to tell you, you're feeling exactly what you should be feeling. You're a novice nurse practitioner. And when you're a novice, there's anxiety that comes along with that. But you're prepared for this profession. You're prepared. You've been a nurse and you did the preparation even if you hadn't been a nurse for 10 years. You've done the preparation for it to become a nurse practitioner. Again, community, you need mentors. And if you're going into as a psychiatric nurse practitioner, I'm going to invite you. Please join the local chapter of the American Psychiatric Nurses Association. You're going to find community there, and you're going to see how quickly you're going to have that transition from feeling so anxious to feeling like you have people you could call if you needed someone to reach out to because of the way you feel. It's going to decrease that anxiety by leaps and bounds. So join your local chapter, the American Psychiatric Nurses Association. It's not just nurse practitioners, it's nurses.
Thank you.
Yeah, you'll get some help in there to deal with that. And
And I'm
some,
part of it, and I'm not
yeah,
even a psych nurse, so
yeah, anybody, so that's it. Anybody could join, any nurse could join. If you're a member though, you're a student still, or you said you graduated?
I'm still a student. I'm graduating in December.
Join now. It's really cheap as a
Okay.
student. It's going to go up as you after you graduate.
Oh, okay. Thank you.
So you're going to save a couple $100 or something if you join her as a student. Don't tell them I
Thank
said that,
you.
but this is going on YouTube.
Of course.
We'll edit that part. We'll edit.
No, no, you can leave it. You can leave it. Um,
Let's see.
but congratulations on that, and yeah, on
Thank,
becoming an NP. Come
Thank
see
you so
me.
much.
Come work with us.
Thank you. Thank you.
yeah, but congratulations.
Thank
Yes.
you.
Anyone else have any more questions? All righty. Well, seeing none, first and foremost, in closing, I want to thank each and every one of you guys for joining us this evening for this nursing mental health webinar. Again, it's something dear to me because I did do that as my DNP project. I also wanted to extend a very special thank you to Dr. Michelle Giddings-White for her powerful presentation and for reminding us that caring for ourselves is vital for caring for others. For the licensed nurses, you will get a you will get a post-webinar survey to receive your CEs. And for the students and other attendees, you will get a certificate of attendance. Again, we appreciate your time and your commitment, and we look forward to seeing each and every one of you at our next event. Or if you want to join us, please reach out to Dr. Where's she at? I don't see her. Dr. Tracy Glover, Johnson Glover. She will definitely she's our chair for membership. And in closing, Dr. Giddings, you want to say anything?
No, I just want to again thank you guys or ladies for joining, and if we have any men on that I'm not seeing, thank you guys for being here. I think we need to keep talking about mental health, and as nurses, we need to really form stronger communities. And that's my word to you. I appreciate every one of you that joined this webinar.
Yeah. Thank you all. And again, Alexandra, have a great congratulations and have a great experience as far as learning. I was a novice nurse practitioner myself, so I can definitely relate to that. So definitely, everyone said thank you, Dr. Giddings. They really appreciated your presentation.
Thank you. Thank you.
Yeah.
My honor. My honor.
All right. Well, thank you guys again. That concludes our webinar. Hopefully, we'll see some of you guys at some of our events, and you have a safe and beautiful night.
Thank you. Thank you,
Thank
ladies.
you. Bye.
Thank you.
Thank
Bye-bye.
you.
All righty.
Tracy? Oh, Tracy's off
Tracy,
already.
gone.
I want to
And-
know if she got a response back from him.
oh, I don't know. You may want to
I'll
reach out
call
to
her.
her. Yeah.
I'll
Well,
reach out to
Nikki,
her.
thank you for joining us. Have a good night. And I'll be sure to send out the survey to you. All right, you guys have a good night. I'm being summoned by the king. He wants his food.
Oh,
'Cause I had
go to the king. The
I look
king is the top
I
person.
didn't feed him. I didn't feed him. I walked him so he can be quiet. But now he's kicking his bowl.
Okay. See you
All
later.
right. See you later. Take care.